What's up, everybody? I'm back here for another affirmations video and to talk about mental health. Today is the 21st Annual World Suicide Prevention Day. It occurs every September 10th since 2003. Mental health is one of the most important topics, not only in America, but in the country. And there's just a lot that goes to it. It doesn't discriminate young or old, no matter what race you are, what gender. You really have to look out for your mental health. Biological predispositions are a huge part of it. It could be environmental. There's so many factors that goes into it, but take care of yourself. And if there's somebody that you're close to that's suffering, always reach out for them, because a lot of people suffer in silence, and that's not the way to go about it. But sometimes people don't have the skills to, and by skills I mean they don't understand how to reach out to people, and that it's okay to do that. According to the American Foundation for Suicide Prevention, suicide is the 11th leading cause of death in the U.S. 11th. And it wouldn't surprise me within the next couple years if it's rising within the top 10. Not that I want it to be, but it's just something that, especially when you mix it, if you have mental health issues, and then you mix it with substances, that it can be a bad combination. In 2022, 49,476 Americans died by suicide. So almost 50,000 people in America 2 years ago, right around the pandemic, died by suicide. A lot of those methods were by gun, but mental health, depression, it doesn't just discriminate in terms of, I use that word kind of as for a lot of things, but there's people that hang themselves, shoot themselves. It doesn't matter which way they go about it. It's not the right way to end things. It's not a good idea to end things, and it doesn't matter what method you're doing it. If you need help, always feel free to reach out to a mental health professional or a friend, anybody, and get yourself some help. In 2022, this is also according to the foundation, there were an estimated 1.6 million suicide attempts. That just baffles me. Also in 2022, I guess some data on the website here is inconclusive for 2023, so that's why it's 2022. The age-adjusted suicide rate in 2022 was 14.21 per $100,000 individuals. 100,000, not $100,000. But here's something also that needs to be talked about. Suicide rates by age range. A lot of people feel like, or have an opinion that suicides are it's for weak. It's not only for weak people, but they're weak-minded people, and it's mostly young kids out of college. And there's a lot of stigmas and misinformation. But according to the Foundation for Suicide Prevention, the American Foundation for Suicide Prevention, in 2022, rates were highest for adults ages 85 years and older, 23.02 suicides per 100,000 people, and the next highest for those 75 to 84-year-olds, 20.26 suicides per 100,000 people. Compare that with rates the year before that in 2021. The suicide rates increased for those ages 35 and older and decreased for those 34 and below. I'm 36. Youth below age 25 have had consistently lower suicide rates than middle age and older adults. It says here in the study. In 2022, adolescents and young adults ages 15 to 24, the rates for suicides in that age range declined from 15.15 per 100,000 people to a rate of 13.62 in that same amount of people. Those were the amount of suicides. So that's a great thing, but 13.62 is still a lot. So if you're somebody who deals with mental health, if you have depression, bipolar disorder, suicidal thoughts, all the above, or anything else, you can do it. You can get through it. You can survive. You can have a normal, healthy life. You can be happy. You can have everything you want to. You just need to take the steps to get to that level. And sometimes it's usually not an overnight process. For me, I've dealt with suicidal thoughts for 20 years. I'm still dealing with it. I have a great support system. It's different for everybody. Sometimes it depends on, there's different reasons for different things, in terms of everybody's body's built differently, and it's just, there's a lot that goes into it too. But seek help. It's not weak. It's not stupid. It doesn't make you any less of a man or woman, person, to go out and seek help. I have to give a shout out to a couple friends of mine that do concerts, that do shows, that raise money for mental health awareness. Full blast. Shout out to you guys. And so it's something to keep in the back of your minds. It doesn't matter if you deal with depression, suicidal thoughts or not. I'm sure there's somebody, a neighbor of yours, a close friend of yours, a family member, maybe all the above, maybe somebody you least expected, that deals with it. And if you care for them, if you think they're a good person, if you have admiration, respect, and love for them, and you feel like they're struggling, or if it looks like they are, go with your gut and reach out to them. Be a better friend. And if you're somebody that's dealing with it firsthand, seek medical professional, seek counseling. You can get medication for it. There's everybody's body is different, but I've done it. I've been through it. You can do it too. And I'm not trying to make this about me, but since today is World Suicide Prevention Day, since 365, 7 days a week, everybody around the world deals with this, no matter what sex you are, what age you are. Like I said, when I saw the figures, when I looked down and did some research, I was surprised at the amount of people within that older age range in the 70s and 80s that committed suicide. But if you think about it, a lot of people from that from the greatest generation and that are from that era, back then, mental health and depression was considered weak. The standard was that it wasn't a good thing to admit to it. And you've seen that with football players. They're getting CTE, they're getting depression. So, and that's another thing with contact sports, if you're involved in that. So make sure you take care of yourself and be a better friend to yourself. And if you know somebody that's also struggling, there's also the suicide prevention hotline. And there's always something other than maybe what your end plan is. Some people's end plans is, I'm going to commit suicide and put myself out of my misery. Well, maybe in your mind, you're putting yourself out of your misery, but for your best friend, for, your mother and father, for your siblings, for your children, your spouse, I know a lot of times when people are in, suicidal, having suicidal tendencies, they're not in the best frame of mind, and they're not thinking of, trying to figure out a way to put this. They're not thinking of anybody else, and by that I mean they're not setting out to hurt people. They're just trying to end their suffering. I can understand that because I've been there, but at the same time, as people have told me, as I've gone through it with suicidal thoughts, and preventing that from happening. You don't want to do that to yourself. You don't want to do that to your friends and your family. It has nothing to do with shame. It's just something that it would cause. Sometimes it's a counteracting thing. So by you doing something, maybe you try to hang yourself, and maybe you feel like you would be out of your misery, but at the same time, it counteracts, because by doing that, your best friend of, let's say 30 years, or your wife or your husband or your kids, or your buddies, or you're wondering what's going on, and they're distraught, and you hurt them by doing it, and maybe you didn't realize it, but every action has a reaction, and as they say. So I just feel like it was important for today to talk about this, and I have my struggles going through this. I deal with this every day, but mental health is so important to me, and in this country, you look, 11th leading cause of death in the U.S. That's just in the U.S. I'm not sure what it is outside of the country, but be a better person to yourself. Enjoy life. If you're unhappy, take the necessary measures to try to end your suffering in a way that's keeping you alive, and that way there's no violence or self-harm, just do everything you can to try to enjoy life and make the most out of it. We only get one of it. We only get one life, and there's just one more thing I wanted to do. So I want to stress this again. Help is always available. You can always speak to somebody 24/7 around the clock. The 988 Suicide and Crisis Lifeline. There's multiple languages, English and Spanish, available 24 hours. Call that 988 number, or you can text it. And there's also, if you do a Google search, you can also, I'm sure, find agents online that are willing to speak with you. So you are loved. Um, you're a good person. Be there for yourself. If you're unhappy, take the necessary steps before it's too late and you do something that, it's regrettable and that can't be fixed. All right, everybody. Thank you for listening. I'll talk to y'all later.